Good morning, guys. How you doing? I hope you are doing fine. Well, today I will be discussing a very important branch that is important for the exam, and 99% chance you will find such situation in the exam, okay? And there are no many stations when it comes to this branch, so please make sure you master it well, which is problem colleague. Problem colleague. What is the meaning of a station talking about problem colleague? Okay, before I start the branch, before I tell you what's happening, I will tell you simply these scenarios discuss an hospital setting where you and your colleague has made a mistake. Okay, so made a mistake like what? Like, for example, your colleague has appeared to the ward smells of alcohol. Your colleague, you've seen him yesterday injecting drugs, and he appeared today and he was quite not talking sense. Your colleague, for example, is being coming late to the hospital. So problem colleague, there is a problem that your colleague is doing, there is an issue that your colleague is doing, and it's your job to discuss with him what is happening and how would you approach such scenario. Okay, so in a simple way, problem colleague stations is you and your colleague. Your colleague could be junior, your colleague could be senior. For example, you are an FY2 doctor, your colleague could be an FY2, or your colleague could be a consultant. Okay, so simple. Or it could be a student, so student, junior, consultant. All right, and they are all similar. The only difference is who to escalate to. When you escalate the matter, when you tell, if you are a medical student, I will escalate to your senior who is educational supervisor. If you are an FY2 doctor, you will escalate to the consultant. If your colleague is an FY2 who made a mistake, so you escalate to the consultant, okay? And the consultant, you escalate to the clinical lead, okay? Anyway, forget about this now. Today you are dealing with problem colleague when the conversation is between you and your colleague regarding a matter, regarding something that he has done wrong and he shouldn't have done, okay? Okay, I will give you a structure, okay? Brand new structure for problem colleague, okay? But before that, before I tell you the structure, before I give you the structure, I would like to emphasize on the fact that you need, before you approach, before you start the station, after confirming identity, to what? To build rapport. What is rapport? Rapport is talking to your colleague in a friendly way. So before we start the scenario, before we start the station, before I tell my colleague I have seen you doing such and such, build rapport. Rapport means I'm Dr. Fatih Al-Bab, or I'm Dr. Zahir. Can you please confirm your full name? Well, my name is such and such, okay? I'm one of your colleagues here in the department. How's everything in the department? How's everything going? How's your work today? Is it busy? Okay? Have you seen any exciting cases? So basically, building rapport. So the first step is building rapport. But what's after building rapport? So any problem colleague station, I will follow a structure called SPICE. S-P-I-E-S. SPICE. So I will follow a structure called SPICE. But before SPICE, what did I say? Build rapport. So before SPICE, what should you do? Build rapport. What is the meaning of building rapport? Building rapport is when you approach your colleague, talk nicely. Open something that's not related to what you're going to say. How's the work today? Have you seen any exciting cases? Okay? How do you find the wards? How do you find the department? Like this. Then I will follow SPICE. What is SPICE? S for seeking information. S for seeking information. Seeking information. Seeking information about what? About what happened. About the incident. P for patient safety. Patient safety. Patient safety. Patient safety. What do you mean by patient safety? The relationship of what happened to the patient safety. Is the patient safety compromised because of what happened or not? I initiative. I initiative. I initiative. Initiative means what will you do? What will you do? You. You are the doctor who is going to speak to your colleague. What initiative have you taken? What did you do or what will you do? E, escalate. E, escalate. Who would you escalate the matter to? Who would you escalate the matter to? Would you escalate it to the consultant? Would you escalate it to the educational supervisor? Would you escalate it to the clinical lead? Who would you escalate it to? S for support. And what I mean by support? Support your colleague. Your colleague. Support your colleague. Support your colleague. Support your colleague. So the support. So whenever I approach any problem colleague station, number one, I will build rapport. I will build rapport. I will build rapport with my colleague. Number two, I will follow the structure, SPICE. I will start seeking information about what happened. I will start checking the patient's safety, is it compromised or not. Then initiative. Initiative is like management. What will you do? What will you do? So I will do such and such and such. Then escalate. We will escalate this matter to the consultant or to the educational supervisor or to the clinical lead. And finally support. How would you support your colleague? Okay? So we'll start reading the stations and then we'll follow the structure and all this. Oh, it's all about how to talk, yeah? It's all about how to talk. It's all about how to talk. So scenario one, you are an FY2 doctor, okay? Let me, before I start with the scenarios, tell you some examples of how to use these steps. Number one, seeking information. For example, if the question said to you that the nurse has told you that Tony is an FY2 doctor, is smelling of alcohol. She smelled alcohol on him. Would you believe her or not, you as a doctor? No, you will seek information. Or she's seen him drinking alcohol on the ward. You will seek information. You will talk to him. An open question. Is there anything you'd like to tell me? Is there anything in seeking information now? Seeking information. Is there anything you'd like to tell me? For example, he will say, no, like what? Well, the nurse has seen you drinking alcohol, for example, in the ward. What would you say? No, she's lying. Third step in seeking information, why would she lie? Why would she lie? Well, she doesn't like me, she hates me. Well, the nurse is saying this, you are saying this, I'm in the middle now, I'm in between. Please help me understand the situation. Then he will say, no, I haven't. Are you sure? This is the last step. When you say to someone in UK here, are you sure? It's like, please be straight, don't lie. For example, that's seeking information. Then patient safety. He was drinking alcohol. What is the effect on the patient? Maybe he's seen patient while he was drunk. Maybe example. So I will follow the structure and I will end up by finishing the station. But again, at the end of the day, it's all about how you talk. It's all about how you present yourself. It's all about how you approach your colleague. Okay? So, scenario number one. You are an FY2 doctor. You were told to speak to your colleague, John, who is an FY1. As he was seen, okay, drinking alcohol in the ward. Or it can come as he was noticed to be smelled of alcohol. So he smelled alcohol in the morning. Okay, one of the nurses smelled alcohol on him in the morning. And this is the third time for the nurses to smell alcohol on him. Talk to him. Okay, so now I'm talking to my colleague and the question said that the nurses smelled alcohol on him, and this is the third time. Our approach, before I start SPICE, I will build rapport. So I'm Dr. Fatih Al-Bab, one of the FY2 doctor here in the ward. Can you please confirm your full name? He will confirm his full name. Please smile. That's no Breaking Bad news station, so be friendly. Well, how's everything with you in the ward? How do you find the ward here? How is your workload? Are you managing? Do you have any concerns? That's it. Building rapport. And when you build rapport your own way. Any way you want. Okay? That's it. After building rapport with my colleague, I will start SPICE. Seeking information. So when I start seeking information, I will start by what's mentioned in the question. But before that, I will give him open questions. So seeking informations 5 steps. I use 5 steps. I use 5 steps. I use in seeking informations 5 steps. What are the 5 steps? So, step 1, I will say open question. John, is there anything you'd like to tell me? Is there anything you'd like to open for me? He will say, well, no. That's open question. Question number 2. I will use what's mentioned in the question. In the stem, I will use the nurse. The nurse has seen you today, and either, as I mentioned in the question, you were drinking alcohol on the ward, or you smell. The nurse mentioned that she smelled alcohol on you today, and this is the 3rd time to encounter you smelling of alcohol. He will say to you, so, first step, open question. Second step, direct the question from the stem. Direct the question, what was mentioned there? He will say, no, she's lying. The 3rd question, the third. Why would she lie? Why would she lie? Why would she make these things up? He will tell you whatever reason, whatever excuse. Step 4, in seeking information. You will say to him, well, the nurse said that she smelled alcohol on you for the 3rd time. While you are saying no, this didn't happen. I am in between here. I am in the middle. Please help me understand. Then you will say, well, she's lying. That's not true. Are you sure? Are you sure that this is not true? This is the final and the strongest step in seeking information. Are you sure? It's like you are saying to him, don't lie. So are you sure? Then seeking information is finished. Then patient safety. Patient safety, always guys, patient safety means the consequences of what happened on the patient. That's patient safety. So in patient safety, I will signpost before I start step 2. Before I start the step 2, which is patient safety, I will signpost. I will say, John, you know the effect of having any substances, like any toxic substances like alcohol or drugs, on our decisions, on the doctor's decisions, yeah? So is it all right if we have a chat about the patients that you have seen today? So I signposted before I started patient safety. So I signposted saying, John, as you know, the effect of any toxic substances, like for example, alcohol or any drugs, actually can cause a serious consequences on our decision making when it comes to patient safety. Am I right? Yes, you are right. So I will start seeking information about patient safety. I will start by, how many patients have you seen? How many patients have you seen? How many patients have you seen? Okay? Any of these patients were emergency situation? Any of these patients were emergency situation? Any cases you had to send home? Any cases you had to send home? Any discharges? Okay? So, in patient safety, I'm talking about what happened. What did he do? How many patients have you seen? Well, I've seen 5, 6 of them. Any of them were emergency, any of them you had to discharge, any of them you sent home, any of them, for example, were difficult cases, any of them you did not discuss with your senior. So basically, I am doing data gathering about the patients. But when I started about the patient, I said the first thing about patient safety is any emergency cases. Well, because PLAB 2 is being safe, doctor. So I will start by checking the emergency cases first. So patient safety. So patient safety, how many cases have you seen? Any of them emergency? Any of them were needed urgent referral? Any of them needed discharge? So for example, that's the patient safety. And I will tell him, I will make a list of all the patients that you have seen. Then I will go to initiative. Initiative is, what will I do? What will I do? Initiative is me, not the colleague. Initiative is me. What are the initiatives that I've taken? So initiative, is a part of management. So initiative in brackets, I consider it as management. So initiative, I consider it as management. What will I do in this case? So number one, I will first of all ask my colleague to stop working for today. Stop working for today. Stop working for today. Stop working for today. Step 2, I will find a replacement. So stop working for today. I will find the replacement. Then step 3. After you ask him to stop working for today and after you yourself find the replacement, step 3, I will review the patient. And I will make sure that they all being seen. Okay? So, but in management, as we have done signposting in patient safety, we have done signposting. In initiative management, I will do signposting. Always, guys, this consultation, always this conversation has to be two-way conversation. I always tell you, I always emphasize on the importance of two-way conversation, which means like a ping pong, throw the ball, he will throw it up to you. Give him the ball again, he will give it to you. So before you start the initiative or management, always tell him, is there anything that you think we should do to move things further? So that's a signpost before initiative, signpost before management. Is there anything you think we should do to move things further? Which means I'm taking his opinion in management. I think I should stop working for today. That's right. Is there anything else you think we should do? So basically, always ask open question. Open. Is there anything you think we should do to move things further? Is there anything you think we can do in order to remedy this situation? So always signpost before initiative, before management, to make sure that he thinks that he's involved in management. That's what he thinks. He thinks that he's involved in management. So what will we do? I think you should stop working for today. What do you think? Also, I will go and see the patient myself to make sure that all the patients have been seen and everything is safe. Would that be right with you? Review. And I will start finding a replacement because we're going to be short staffed today, so I'll make sure you find the replacement. So these are the 3 steps. Now, seeking information, patient safety, initiative. What about the escalation? Escalation is basically when whoever I escalate to, the boss. If it's a student, the escalation will be to educational supervisor. If it's an FY1, consultant. If it's a consultant, the escalation will be to clinical lead. So escalation. So again, I will make it as if it's optional, as if. What do you think if we inform, what do you think if we inform, and I will tell whoever. So what do you think if we inform the consultant? I think he will be in a better position in giving us an advice. So what do you think of? So what do you think of informing the consultant? So that's always escalation. So escalation, make it optional. What do you mean make it optional? It's not optional, but make it as if you are giving him the option. What do you think of telling the consultant? What do you think of informing your educational supervisor? Then when you tell him what do you think of, as if you are making it optional. Well, he will tell you, well, doctor, you know, actually, like if we tell him he might cause troubles, well, in fact, educational supervisor, or in fact, the consultant may get to know anyway, but better for you to go in order to explain yourself, and his job is to give us an advice on what to do next. So escalate. So escalate is telling the consultant, telling the boss. And always when you advise your colleague to escalate, always make it as if it's optional. So always tell him, what do you think of telling the consultant? And stop. Why stop? Because some doctors say, what do you think of telling the consultant? I think you will be happy to tell him. Before, no, stop. Maybe he will say yes, and you don't need to say anything next. What do you think of telling the consultant? And then stop. He will say, well, I think, no, I don't want to tell him. May I ask why? He will say, well, because if I tell him, I might have some problems, I might have some troubles, you understand? So you will say to him, well, I know what you're saying, I totally understand what you mean. However, telling the consultant, it's better from you, so you will be able to explain yourself in a better way, rather than him might be hearing from anybody else, and then it will be even worse situation. Also, the consultant is here to help us, because I'm sure he dealt with such situations before. That's it. So that's escalate. So escalate is what do you think we should do first? That's number one. What do you think we should, escalate is informing the consultant and always incident form. And always incident form. So that's escalate. So in escalation, I will always tell the consultant, if it's a junior, I will tell the educational supervisor if it's a student, and I will tell the clinical lead if it's a consultant. If the consultant is the one who made the mistake, okay? So the only difference in the structure, if it's a consultant, is the escalation. That's it. Who to escalate to. And incident form, in all cases of problem, colleague will make an incident form. So we'll make an incident form. So always he will say to you again, as you told him in the escalation part, consultant, and the escalation incident form, when he said to you no, don't tell the consultant we had an answer. And if he tells you no, incident form no, say to him, well, this is actually incident form is protect the patient and to protect ourselves, because in the incident form we will write down that such incident happened and we made sure that we put matters right. So that's why you are actually assuring him. Say to him that in the incident form, it's not only to harm you, it's not to harm you. Sorry, it's not, don't use it's not only, yeah? It's not to harm you. In fact, the incident form is protect us and the patient. Why? Because in the incident form, we will write what happened. Yes, there was a mistake, but we will also write that we worked on the mistake and we made things better. Clear? Clear. Finally is support. And support is now supporting a colleague, poor colleague who was drunk, poor colleague who had alcohol, support him. In this final step, support is support your colleague. Support your colleague. So supporting the colleague came after patient safety. Because the colleague is one, the patient is plenty. So always support the colleague will come at the end. So is there anything you think I can help you with? Well, may I ask, do you have any stressors in your life? Is there anything stressing you out now because he's drinking alcohol or he's taking drugs? Well, have you spoken to this about anybody? Well, is there anything I can do to help you? Well, for example, if he's having any troubles, have you spoken to any relative, to any friends? And at the end, I can refer you to your GP. We can refer you to your GP so he can actually offer you CBT, talking therapy, if it's something psychological. So basically the support is supporting your colleague. Is supporting your colleague. The support is starting by you, and then friends and relative around him, and finally referring him to his GP. You can refer him to his GP because it will have to go the formal way. So I can refer you to your GP where they can actually offer you talking therapy, etc. Okay? So this is the support. So the support, the colleague comes last after the patient's safety. Okay? The second station is the second station is you are an FY2 doctor. You have been asked to speak to your colleague Anderson, who is an FY2. Why? As he was seen yesterday by the nurses taking heroin, injecting heroin and taking drugs. So it's the same as alcohol, guys, but heroin. Okay? The same as alcohol, but heroin. It's a station where he's not taking alcohol, he's taking heroin. And he was seen today in the ward round, okay? Not making any sense, and everybody's making fun of him and not himself. Okay, so today he was seen, for example, intoxicated again. So different colleague, but the first one was alcohol, the second one is heroin. So the second one, the only difference is heroin. It will be the same approach. The same approach, yes. So I will start by, I'm Dr. Fatih Al-Bab, one of the general doctors in the department. Can you please confirm your full name? He will confirm his full name. Well, I'm your colleague here in the department. Have we met before? That's like as a start. I'm your colleague in the department here. Have we met before? Yes, no. Then rapport. How's everything? How is your work today? Have you seen any exciting cases? Although, again, is it busy today? How are you managing? Is everything all right? Then rapport's finished. Then I will start by spies. Spies, number one, seeking information. How many steps? 5 steps. Step 1, open question. Is there anything that you would like me to talk to you about? Is there anything that you would love to talk to me about? Is there anything that you want to talk to me about? Is there anything that you want to discuss with me? Is there anything that you want to discuss with me? He will say yes, no. Step two, after open question. Step two, use whichever in the stem. The nurses has been talking about you that you have taken some toxic substances, you have taken some IV drugs, and they are talking about it on the word here. What would you say about it? Yes, no, they are lying. Step three, why would they lie? Why do you think they will make these things up? Step three. Step four, they are saying yes. You are saying that I'm in between here. What do you think I should do? I am in between. Please help me understand. Step five, if he said no, are you sure? But by the way, it doesn't mean that in the exam, he will be reluctant. No. He might, when you say to him, is there anything you would like to tell me? Is there anything you would like to open for me? He might give you the problem. He might say to you, yes, doctor, I was having this, so you don't need to carry on with the steps. So you carry on with the steps if he is reluctant, if he is not telling you, if he is not talking, then you carry on with the steps of seeking information. So make sure you seek information first. Step two is patient safety. So you signpost, as I told you, patient safety, signpost before the patient safety. Tell him, well, having toxic substances can affect doctor's decision, and actually it can reflect, or it can cause, for example, serious circumstances on the patient's safety. So is it okay if you tell me how was your shift today? How many patients have you seen? Any of them were emergency? Any of them you had to escalate to the senior? Any of them you had to urgently refer them? Any of them, for example, you had to discharge them? So any patient did you admit? Any patients? So that's patient safety. Then you do data gathering about patient safety, then go to initiative management. Again, signpost it. Say, well, what do you think? What do you think now we should do in order to move the situation further? So you are signposting the initiative, the management, because it's always better if the colleague who made the mistake gives us the option of management, but rather than me jumping on him and telling him things. Yeah. So what do you think? What do you think we should do in order to move the situation further? Okay, I think you should stop working for today. What do you think about it? So always make it optional, guys. Always give him the consent. Always give him the option. What do you think about it? Okay, because that will affect your decision. All right. So is there anything that we can do further? Okay, I will find the cover to cover you here, and I'll also go and review the patient and make sure that everything is all right. So basically, when you talk about management, don't forget he's your colleague. It might be quite tense, so always make sure that you're not showing him that you are judging. So avoid showing him that you are judging, because at any time he feels that you are judging, it's gonna be a problem. Okay, now escalate. I said in escalation, two things. You will escalate to the consultant, number one. Number two, indent form. So you will tell him, okay? You will tell him, what do you think of telling the consultant? So don't tell him, go and tell. Tell him, what do you think? So what do you think of telling the consultant? Do you think it will be a wise idea? Do you think it will be a good idea to tell our consultant? He will say, well, yeah, I think it will be a good idea. That's right. That's right. But what if he said, no, I don't think it will be a good idea? Ask him, ask you why. Why do you think it's going to be a good idea? He will tell you, well, because the consultant will, for example, will, find me, will cause some troubles, will tell someone, will tell whoever. He will give you a reason. Say to him, well, in fact, no, the consultant, it's better for you to go and tell him yourself and explain the situation to him rather than him knowing from anybody else. So it will be even better for you to tell him yourself, because he may get to know from anybody else and then the situation will be worse. What do you think about that? He will say yes, no, and well, by the way, the consultant is experienced in dealing with such situations, and he can give us a better advice. Finally, incident form. In the escalation, I said two things. Incident form. So now we'll write an incident form about what happened. Again, he will tell you okay, or he will say no, incident form, why this, that. So to him, well, the incident form is not to harm you. In fact, the incident form is to protect the patient and to protect us. So in the incident form, we'll write down what happened, and we'll write down that we made things better, that we rectified the situation. Okay, support your colleague. So always ask him about the drug that he's taking, why is he taking it. Does he have any stressors in his life? Don't go into cage TWD of the psychiatry. No, it's simple. Simple. Why are you taking it? And do you have any stressors in your life? Is there anything that I can do? Have you spoken to any relative or nearby or close friends? Okay, they can help you with improving the situation, or we can refer you to a GP. Okay, so that's the same thing, the same station, the same approach. Okay, the third station is you are an FY2 doctor. Okay, you have been told to speak to your colleague Jonathan, who is an FY1. Why? As he put some posts on social media about one of the patients. So he put some posts on social media about one of the patients who thought or who was pretending to be the queen in the psychiatry department. So one of the patients was pretending that she is the queen. I am the queen, I am the queen, I am the queen. Your colleague took pictures of her and put it on social media. Go and talk to him. So this case is case of breaching confidentiality. So at any time your colleague is laughing, saying ha 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 ha, I've seen her being like a queen, ha ha ha. Don't laugh with him. Don't say to him, I see where you're coming from. At any time he's taking the piss. At any time he's saying, ha ha, look at her. She was looking like a queen. She's crazy. She's stupid. I made fun of her. Don't laugh with him. Don't say to him, yeah, I can see where you're coming from. If he's saying to you, well, oh my God, she was really funny. If you seen her, you will laugh as well. Don't say, yes, yes, I think so. No. So this station is about breaching confidentiality. Same structure. I will approach the colleague. I am Dr. Fath Al-Bab, one of General Dr. Zagir. Can you please confirm your full name? He will confirm his full name. Well, I am your colleague here in the department. Have we met before? If he said yes, yes. If he said no, no. Build rapport. How do you find your work today? How do you find the ward round? How do you find the hospital work? Are you managing? Is everything okay with you? Rapport. After that, seek information. Seeking information in this case, please. Seeking information in this case, please, is about the patient and is about the post. So when you write seeking information, whom I'm seeking information about? The patient and the post. The patient and the post. So be careful. Seeking information about the patient and the post. Tell him, I have been told that you have posted about one of the patients on social media. That's an approach in seeking information. Or you can approach him in another way, which is, if it's written in the question, the name of the patient. If it's written in the question, the name of the patient, like because he posted on social media about Mrs. whatever, so mention Mrs. whatever. Say to him, well, is Mrs. Wilson under your care? Have you seen her? And let him talk. That's an open question. So again, in seeking information, we are seeking information about two people, the patient and the post that was put on social media. How to start seeking information, how to approach it. I will approach it by mentioning the patient name if it is mentioned in the question. Is Mrs. Wilson under your care? If it is mentioned in the question. But what if it's not mentioned in the question? I will tell him, I can see, or I have been told to come and talk to you because you have posted about one of the patients on social media. Then stop. Let him talk. So now seeking information will be about the patient and about the post. So coming to the patient, I will start seeking information about the patient. Why did she come to the hospital? Okay? What diagnosis was given, was made? What were done for her? How is she now? Why do I need to say how is she now? I will tell you later. I will tell you how is she now will help us later in management. How is she now? So now I have gathered the information about the patient. Why did she come to the hospital? Okay, what was done for her? How is she doing now? I want to know, is she stable or not? Because if she's stable, if she is stable, I will tell him later in management, go and tell her. If she's not stable, I cannot go and say to him, go and tell her, okay? Now coming back to the post, I will seek information. So in seeking information, I said patient and post. Okay, what did you post? Is it a video? Is it a picture? Where did you post it? Where did you post it? I want to know, is it Facebook? Is it Twitter? Is it YouTube? Is it what? Where did you post it? So what type of post is it? Is it picture, video? Where did you post it? Where did you post it? Was it private or public? Was it shared with everybody or was it private? Was there any patient details on it? Patient name, date of birth, address. So I'm gathering the details about the post. So I gather details about the post. I gather details about the patient. And then I will go to step 2 is patient safety. Patient safety. In patient safety, I will start discussing about patient confidentiality, because that's the patient safety here. Confidentiality. So I will start talking to him. Didn't you know that this is a breach of confidentiality of the patient? What do you think if any of her relatives seen this on the social media? I'm sure they won't be happy. What do you think of the post contains, for example, the patient address and the patient date of birth and the patient name? Okay, and talk to him in patient safety about confidentiality. That this is actually was a breach of confidentiality and this shouldn't have been done. Initiative, management, initiative. In the initiative or the management here, what do you think? Again, signpost it as an open question. What do you think we can do to move the situation further or to make the situation better? So here, number 1, in the initiative, go and delete the post. Go and delete the post. That's the main core here. Delete the post. Delete the post. Delete the post. Okay? Because that's managing. That's managing. Number 2, how is the patient? If he said there in the seeking information she is fine, she's well, then you can say to him, well, you can go apologize for the patient and tell the patient. So apologize and tell the patient. What if she's not stable? So you should not tell her now. Wait till she's stable and then go and tell her. So please, in management, in initiative or management, number 1, delete the post. Number 1, delete the post. Number 1, delete the post. Number 2, if the patient is stable, if she is well enough to receive information, to receive such news, go and tell her. Go and tell her. Apologize first. Tell her and make sure you tell her that we have deleted the post. Escalate. So in this case, again, I will start by what do you think we can do? Do you think we should tell the consultant? Yes, no. If he said no, say to him, well, he will get to know from other people, so it's better for you to tell him and explain yourself that such and such happened. Incident form, I think we'll put an incident form. Again, he will say to you, no, don't put incident form, doctor, no. Well, incident form is to protect the patient's safety and us as well. So we'll explain in the incident form that this incident happened and we made things better and we have basically solved the matter and we have put things right. Support your colleague. So tell your colleague that, and the support that patient confidentiality is mandatory. You can lose your GMC registration over it. Please make sure you don't do this again in the support. And there is a very important question here in the seeking information that you ask your colleague, have you done this before? Have you done this before? So always ask, have you done this before? Have you done this before? Okay. Okay. One more station is basically you are an FY2 doctor. You were told to go and speak to your colleague Jonathan, who is an FY1. Why? Because he was late inserting cannula to Mrs. Thompson. So problem colleague late inserting cannula. So your colleague is late inserting cannula to Mrs. Thompson. She was due for her antibiotics an hour ago and he was late inserting the cannula. So problem colleague. A problem made a mistake that he was late to inserting cannula and the cannula was supposed to be inserted an hour ago and the patient is angry. So come again, I'm Dr. Fath Al-Bab, one of your doctors here. Can you confirm your name? How is that work here? How is your work in the department? How do you find the department? Is everything all right? Are you managing well? Do you have any concerns about your work? Building rapport. Then seeking information. Seeking information by using what's mentioned in the question. Well, I can see from my note that Mrs. Wilson is under your care. The name will be mentioned of the patient. Mrs. Wilson is under your care. Yes, she's under my care. How is she? How is she? Are all investigations up to date? Is everything okay? Have you checked all her investigations? and is she receiving her medication? So you're trying to seek information with an open question. Is Mrs. Wilson under your care? And stop. Why? Because he will remember. Most probably, oh my God, I forgot to insert the cannula. Rather than saying, why didn't you insert the cannula? So always, is Mrs. Wilson under your care? How is she doing? Okay, how is she doing? Is all her investigations up to date and checked? Is she receiving her medication? So that is the kind of open conversation that we will create. Then he will, oh my God, I forgot to insert the cannula. So when he mentioned I forgot to insert the cannula, go to patient safety. Go to patient safety. And be careful, guys, because there are many reasons why this colleague might, for example, inserted the cannula late. What are the reasons? It could be that he was involved in CPR. He was involved in an emergency case. CPR, cardiopulmonary resuscitation. And it could be that he was in the library reading something, or he was having fun somewhere. So please be careful, because not all the cases will be that he's doing something wrong. Maybe it will be, yes, that he should have informed the nurse that he will be late, but at the same time, maybe he was engaged into something emergency. So in seeking information, open question. Is Mrs. Wilson under your care? How is she doing? Her investigations, her medications, is everything up to date? Okay, is anything in her investigation delayed, or is there anything when it comes to her management plan, or is she receiving her medication? Open question, okay? Then you will go to patient safety. You will say to him, well, I have been told to come and speak to you because the cannula that Mrs. Wilson was supposed to have is late. Okay, is there any reason why? Always, guys, ask like this. Is there any reason why? And then he will say to you, either he will say, well, there was a very exciting like x-ray. There was a very nice x-ray that I was reading, and then I was gonna go and insert. Or he might say to you, I was involved into an emergency situation. So if he said to you there was an x-ray that I was reading in the library, that's not valid reason. So then you can say to him, well, I think you should know about the priority, how to put things into priority. I mean, putting the cannula is more important than reading the important x-ray. Or what do you think? You could have read this x-ray at another time. So always, guys, the way you're talking, don't be judgmental. Don't be harsh. Don't be harsh, okay? What if he was saying that I was engaged into CPR? Perfect. So you will say to him, well, how was the result of the CPR? Was the patient okay after the CPR? So try to break the ice. And then you can say to him, did you ask any of the nurses to tell the patient that you will be a bit late? That's it. Okay? And then in the patient safety, you will say, well, the patient is on antibiotics. I mean, is it late? I mean, was she due for antibiotic? Why? Because yes, it could be that the cannula was supposed to be inserted an hour ago, but the antibiotic is due in 2 hours. Or it could be the cannula was supposed to send an hour ago because the antibiotic was due an hour ago. So now it's late. So always say to him, what is she receiving through her cannula? Well, doctor, antibiotic. And is it late now? Is she due for the antibiotic? Is it late now? Or when should the antibiotic be given to her? Doctor, in 2 hours. Or doctor, in 1 hour. So it's less harm than if it was supposed to be given. So yeah, it's in 1 hour. Then you can say to him, well, I think now initiative. So patient safety, we asked about what is she receiving through the cannula. If it's antibiotic, we asked about, is it late or is it due? Okay. And in the patient safety, we made sure that we've asked about what was supposed to be done and the priority and what was he doing. That's why the cannula is late. Now go to initiative. Initiative is go to the patient, apologize for her, insert the cannula, and if the medication is due, give her the medication. That's the initiative. And by the way, guys, it's very important in initiative, as I told you, to make it two-way conversation. Don't make it as if you are jumping on top of him. Make it always two-way conversation. two-way conversation. What do you think we can do to move the situation further? Well, I think I should go to the patient. Do you think you should apologize for her or not? Yeah, well, I think I should apologize for her because it will make the situation better. And then I think you should go, insert the cannula right away, apologize for her. So that's the initiative. Go, insert the cannula, apologize to the patient, tell her the reason, insert the cannula, give her the antibiotic. Escalate, 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 escalate. In this case, again, we'll escalate to the consultant because he's an FY2. We will write incident form, same. Support, support, support. In this case, support to who? Your colleague. So I will tell my colleague that there are courses about prioritizing your job. So they will learn you, they will teach you how to put things in order in terms of the priority. Okay, what do you think of taking such courses? If at any time you need any help, you feel that you are overwhelmed, okay, you can come and let me know, okay, or you can come and tell any of the staff, okay, we are all here happy to help. We are all here working as a one team to provide good service to our patients. So in the support is supporting your colleague, not supporting the patient, supporting the colleague, not the patient, okay? Finally, last station is about medical student coming late. Medical student keep coming late, or it could be an FY2 doctor keep coming late to the hospital. Again, the purpose of this station is basically talk about the reason why he's coming late, Number two, try to tell him about the effects of late arrival. That's very important. So again, I will follow the same steps, and in this coming late, we will have to, by the end of the station, to for John to know that the effects of coming late on the patient's safety, and also why is he coming late. However, in this case, it could be a student, it could be a doctor. If it's a doctor coming late, so a doctor sees patient, examine patient, discharge patient, has duties. So in this case, it will be that you are saying to him, okay, so coming late, you might miss something urgent, you might there might not be cover there, and it will affect. But a student coming late, he will miss lectures that is important lecture maybe, and lectures that will affect his learning curve. So basically, a student not like a doctor. A doctor, he sees patient, he examines patient, he sees emergency situation. A student, no, a student is just missing lectures, but it will affect him in the future, okay? A doctor coming late, you will escalate to consultant. Student coming late, you will escalate to educational supervisor. And that's it. Let's start. Rapport. I'm Dr. Fatih Albab, one of the general doctors here. Can you please confirm your full name? Yes, my full name. I'm your colleague here. Have we met before? Okay, or not? Yes, no. How do you find the work? How do you find the department? Is everything okay? Are you managing well? All like this, okay? So, seek information. I can see that I've been told to come and speak to you because we have been told that you keep coming late. What would you say about it? Open question. And seek information, open question. He will say, yeah, I came, okay, it's once, it's so, then how many times? Has it happened before? So again, in seeking information, you want to know, is it the first time or has it happened before? Well, it happened 2-3 times, you know, that I come late. How late? Is it 10 minutes late, guys, or is it an hour late? That's what I'm saying. How late? What time were you supposed to start? I was supposed to start at 8, so what time did you come? I came at 12, so he's late 4 hours. So always when you seek information, you want to know what time was he supposed to start, what time did he actually come, how late this colleague was, and is it the first time that he's late, or has he been doing this before? So that's seeking information. You want to assess the whole situation. Then you will come to patient safety. In patient safety, guys, because he's late, for example, he was supposed to start at 8, he started at 9. So there is an hour late here, yeah? So you want to know who is covering this time, who is covering this hour in the patient safety. Now, you know, coming late can compromise patient safety. So who was seeing the patient? Was there anyone covering you during this time? Or, you know, you want to do data gathering about patient safety. So was it covered? Was it not covered? So always discuss, always talk about it. He will tell you, well, it was covered by my colleague, when it was not covered. So have you missed any urgent situation? Have you missed any emergency cases? Okay, have you been told that when you were late there was any emergency cases that you have missed? This, that, who was managing it, was it covered? So always you are talking about the coverage of the period that he was late. Okay, then initiative, management. Okay, sorry. And in seeking information, don't forget to know why is this happening? Why is this happening? So always find the reason why is this happening, why you keep coming late. He will tell you traffic, he will tell you I woke up late. So make sure you find out the reason why. What could be the reasons, guys? How far do you live away from the hospital? And you can say to him, what time do you sleep? What time do you wake up in the morning? You want to know, maybe he sleeps late and he wakes up late. So don't forget in seeking information to know why. Why in seeking information? Why is he coming late? Because it will help you in management. Yeah. Patient safety, we know. You need to know, was it covered? Was it not covered? Did he miss any cases? Okay. Initiative management. Management is basically you talking to him about the fact that the reason why he was coming late. So in management, try to address it. Try to tell him, well, what do you think of this? What do you think of that? Depending on the reason. If he said to you, I sleep late, so what do you think? You can go to bed early, and then you can discuss with him what makes you go to bed late. Okay, maybe he's taken any toxic substances before. So that's management. So management is preventing him coming late again. Escalation is basically, again, telling the consultant, but always open, make it open. What do you think we can do further? Do you think we should tell the consultant? He will say no. Again, like previous, I think we should tell him, because if we don't tell him, he might get to know from others. So it's better for us to tell him, so it will be more wise, because you will be able to explain yourself in a better way. Incident form, we'll put an incident form, and doctor, this, why you put that, that's not important. Well, the incident form is to protect the patient safety and ourselves. We'll write down that this happened, you came late and the shift was covered, or this or that, and what we made to move things further. Support is basically managing the reason why he's late again, and support him if he needs any help. If he has any difficulties with anything, he can come to you and you can help him. Okay, guys, problem colleague is finished, and it took us 1 hour, and you need to study this branch well, and you can even write your own notes, because it will even help you better in remembering things. Okay, thank you very much.